Hi there, and welcome to this short session on clinical record keeping. Let's start with why we keep clinical records. First off, it's to facilitate the care of, support, and intervention with your client. It is also required to maintain the clinical governance of the organization, and also to facilitate continuity of care should the need arise. Additionally, it will demonstrate your attention to risk assessment and management, and help you to reflect and consider what you may need to discuss in supervision. So, what needs to be considered when writing up clinical notes? Notes must be written and stored on the relevant information recording system and maintained in line with organizational policy and procedure. And all notes must be completed within 24 hours of seeing your client. Remember that clients can request access to their records at any time. As part of your role as a therapist, you have a responsibility to be aware of the information governance procedure and how to manage a request for access and what to do in the event of a data breach. We also need to consider that we need client consent to share any information we hold, unless it is to minimize a significant risk. Let's have a look at what information needs to be recorded. As you may expect, all information recorded needs to be a factual representation of your client sessions, and not based upon personal opinion. Ensure you have the date, time, and location of the session. Be sure to include a statement of client presentation which details an assessment of capacity, physical appearance, orientation to time and place, and any changes to usual presentation. Include a summary of the content of the session, with a link to the contract and treatment plan. Avoid using clinical terms which non-clinical staff wouldn't understand. Also, don't use abbreviations or acronyms. You will need a clear statement of any risk and safeguarding issues, including how you have made your assessment and the management plan. And finally, an overview of the contract and treatment plan and how your intervention is attending to it. So there you are. A short and sweet introduction to clinical record keeping. Please let us know if you have any questions. Thanks for watching, and I'll see you next time.